Okay, this video is called Why You Should Not Half-Ass It. And I say that because I talk to a lot of patients and a lot of doctors, regular patients, to advise them on how to improve their health. And the majority of them always start giving me all this, well, can I still, eat olive oil or fry this or use a little bit of oil or some other stupid comment. And my attitude is you don't understand. You want to do everything as intense as possible. You should be asking me, how can I increase the intensity of disease reversal? If possible. The reason is there's a couple reasons. You can lose a window of opportunity. Here's a really nice book. It's called The AFib Cure. It's by this guy, John Day. He's a real smart guy, good cardiologist, electrophysiologic cardiologist. He talks about atrial fibrillation begets AFib. AFib begets AFib. What that means is the longer you have atrial fibrillation, the worse it gets. The more likely it is to become irreversible, uncurable. At which point you're stuck on drugs all your life. And AFib is a bad disease. People over 65 diagnosed with AFib, 50% are dead within 5 years. Okay, that's like same prognosis as dialysis or, like the 11th worst aggressive cancer malignancy of the common tumors. Okay, so what I'm trying to say is, you're getting older. You're more fragile as you get older. So you want to turn things around as fast as you can because you hit little irreversible steps. For example, I look at lots of brains, lots of spines. Tons of people have silent strokes in their brains. The majority of Americans have had a silent stroke by the time they're 60 years of age. By the way, I'm 62. I have no medical problems at all. I would call my health very good. Okay? My brother is a little bit younger than me. He's a world champion athlete. His health is optimal. I wish I could exercise as much as him. I wish I could work part-time as a clinical doctor, but I work full-time, and in my job, it's sort of like I have to be full-time. It's a long story, but I have to be full-time. So what I'm trying to say is you want to keep your health as high as you can. I'll always go and exercise a little bit more each day just because I sleep better and because I want to maintain a high level of mitochondrial fitness, because it's use it or lose it. Your body has limited resources. If you don't maintain a high level of exercise, your body says, we don't need so many mitochondria, and it'll start getting rid of them, and you'll develop more mitochondrial mutations, and your mitochondria will be less able to function. You will lose the ability to do things you previously could. You're going to do things like you're going to get small silent strokes in your brain. You're going to be knocking off little pieces of heart tissue, plugging up small arteries in your heart, plugging up small arteries in your spine, degenerative disc disease. You'll have disc collapse where you get disc-based narrowing from degenerative disc disease. What I'm trying to say is all these negative things accumulate when you piss around and you waste time. So you don't want to waste time. You want to get things as good as possible. And you always want to aim for the best. Typical person always says some stupid comment, well, at least I'm not as fat as my cousin, or I'm not as fat as this other doctor, or sick as this other person. And what I'm saying is try to be the best you can be so you'll avoid hitting these lower levels. You'll drop from optimal to very good. I'm in very good, and I want to try to stay there as long as I can. I don't want to drop to good. If I have to, I'll accept good, but I'd rather be very good instead of good if I can keep it there. Then you're going to go to okay, then you're going to go to bad, and then, disaster. I would say most people who I see have what I would describe as bad health. Typical American by 60 is fat, sick, and stupid. And what I'm saying is you lose these windows of opportunity if you half-ass things and you waste time. You can always just try the diet and the lifestyle stuff for 4 months. If it doesn't work for you, fine, life goes on, but you should give it a try. Also, when you half-ass it, a lot of times what happens is, like I said, suppose you got the capacity to heal 2 steps up each day. Let's say 2 units of healing. Well, if you keep one bad habit, you drink, some alcohol at night, well, then you're only going to get 1 step of healing. You got 2 bad habits, you're drinking caffeine still, okay, then you can't heal at all. And now you start saying, well, this diet doesn't work, I might as well go back to eat my old diet, and then you just rapidly decline, crash, and burn. So what I'm saying is, unless you go full speed, you risk not giving yourself an adequate chance to heal, and you might never turn it around. And because you half-assed it, you decrease the therapeutic value of this diet and lifestyle, and then you're lost. And for a lot of things, it's the only thing that works. The medical pills tend to be a joke. They hardly work for anything except for, replacement therapies, like for thyroid hormone or for insulin or something. So, again, this is why you should not half-ass it, so you don't have irreversible damage and you don't miss out on opportunities to heal that you don't recognize because you're sabotaging yourself, and so you can maintain higher levels of health because it's use it or lose it. Anyways, I hope that was helpful.